in Queensland. Well, we have some good news today, and that is we have 10 new cases, but 9 of them are in hotel quarantine, so we are not concerned about that. And we have 1 community acquired case, but is linked to one of the known clusters. So that is fantastic news. As I said yesterday, we are looking at 2 preconditions before we can lift the lockdown. Those 2 preconditions is that there needed to be no unlinked community transmission, and the second was high testing rates. Well, I can also thank Queenslanders, because Queenslanders have come out in their thousands to be tested. Thank you, thank you, thank you. There have been 34,711 tests, another record. So that is good news for Queensland, and Easter is good to go. So, in further good news, after discussions with Dr. Young and Police Commissioner and Deputy Police Commissioner, the lockdown will be lifted from 12 noon today. I understand a lot of families in the Greater Brisbane have made plans, and the last thing we want to see are accidents on our roads at 5 p.m. this afternoon into the evening. So, if you have plans, the lockdown is lifted from 12 noon today, and I encourage people to take care on the roads. Please be safe and enjoy your time away with family and friends. Now, in addition, there will be some restrictions that will remain in place for the rest of Queensland, for all of Queensland. And let me just take you through some of those, and Dr. Young will go into some more detail. So for the next 2 weeks, from 12 noon today until Thursday the 15th of April, all Queenslanders will be required to carry a mask when they leave their home. We will also ask you to wear those masks in indoor spaces such as shopping centres and supermarkets, indoor workplaces, public transport. Anyone attending food or beverage establishments, so if you're out there going to a restaurant or cafe or a pub, you must be seated. We have to go back to the seating. This is really important that we are doing this for the next 2 weeks, because we are not out of the woods yet. So the lockdown has been lifted in Greater Brisbane, but we're not out of the woods yet. So I'm asking Queenslanders, all Queenslanders, for the next 2 weeks, if we all do the right thing, we can get through this together. Gatherings at your home right across Queensland will be restricted to 30. Unfortunately, no dancing in public venues, and businesses, of course, can reopen, but it's that 1-2 square metre rule. Now, in terms of outdoor events, there are a lot of big events planned over Easter. They can still proceed if they have a COVID-safe plan in place. But if you are outdoors and you cannot socially distance, put a mask on. It's as simple as that. If you don't feel that you can socially distance and you're in a crowd, put a mask on. That is the safest we can do. Now, in further good news too, we've spoken to Dr. Young about Easter church services. This is really important for many people across Queensland, and of course those services and the Easter Mass can go ahead. It will be 1 per 2 square metres, so most churches have that in place. But if it is, it can be 100% capacity if people are seated and have it ticketed, and the churches know how to do that. So that's further good news. I do want to just mention again that we now have total active cases in our hospitals is 82. The numbers from overseas in our hospitals is now 68. So that's return travellers coming back. And like I said, that is a real risk for us, because I think we are the highest state in the nation at the moment with the most number of active cases in our hospitals that have returned travellers from overseas. So in light of that, I've written to the Prime Minister to ask for another further extension to the end of April in terms of reducing our capacity of return travellers. So I'm quite sure that the Prime Minister will give that due consideration. And in terms of vaccinations, we've done 7,596 vaccinations yesterday. Like I said, We give out our figures every day, and it'd be great to see the Commonwealth do exactly the same. Transparency here. And our total vaccinations now are at 79,534. So look, just before I hand over to Dr. Young, once again, can I really thank Queenslanders? This has been phenomenal. It has been very stressful for everyone, and I just want to thank everyone who's been involved. Most importantly, you at home. People of this state have really stepped up, and people in Greater Brisbane have honestly listened to everything that we have asked of them, and I cannot be more proud than today to see the great efforts of everybody. Secondly, can I say to the businesses out there, I know that has been tough as well. These are tough decisions. These are not easy decisions. And don't think for one moment that I don't think of all of those consequences when we are doing this. But the consequences of not acting are far worse. And like I said, you only have to see what's happening around the world. I saw in France today, they're going back into a lockdown. Schools are being closed again. I think that's their fourth wave. There's a fourth wave happening in the US. We don't want to see that here. I don't want to see that here. The consequences would be diabolical. Now, in further good news too, I'm hearing that the Gold Coast Airport had a record day yesterday with since the number of people coming into the Gold Coast. I understand Cairns Airport is doing well as well. So look, we are expecting a very good Easter. And we welcome, we're lifting that Greater Brisbane as being a hotspot, and I'm asking all other leaders across the country to consider doing the same as well. But if you are coming to Queensland, you'll have to abide by these restrictions in terms of mask wearing, just as the same as everybody else. And really, when you think about it, it's a small thing to do, but it means that we can go out, support our businesses, support our tourism industry, and spend time with our loved ones, which is, you know, a really special time of the year. So look, I'll hand over to Dr. Young, and then the Deputy Premier, our Deputy Commissioner, and then of course we're happy to take questions after that.
So this is very encouraging news that we only had one community acquired case overnight in Queensland, and that was the perfect case, if I could describe it as that. This was one of those participants in that party that happened at Byron Bay. So when the person came back to Queensland, they went into quarantine and they were tested on Monday night, and they were negative on Monday night. Then they were tested again Wednesday morning when they were positive. So they have been in quarantine during their infectious period, so at no risk at all. So definitely a linked case, but also that additional bonus that they were in quarantine. And that was our one community acquired case. And the reason I can be reasonably confident that we're managing these two outbreaks is the amount of testing. The amount of testing over the last 48 hours has been astronomical. Thank you to every single person who's come forward. I know it takes time. I know there are queues, so thank you for doing that. And because of that, we can be reasonably confident that we don't have other chains of transmission happening out there in the community. But for the next 14 days, we will need to continue that testing. So please keep coming forward if you have any symptoms at all, or if you've been to one of those 118 exposure sites that are up on our website. If you've been to one of those, please make sure you continue to come forward so we find the first case, and we can then manage it so quickly like we did with this second cluster. That nurse was fantastic. She was the first case. She came forward. We got on top of it really quickly due to her work and due to the work of Queenslanders. So now we can be talking about lifting those lockdown restrictions and going to a reduced level of restrictions. Now we have to, unfortunately, keep those restrictions that have been in place for the rest of Queensland in place for the next 14 days because we're not completely cleared yet. We think we can manage it with those restrictions and with the response that we've seen from Queenslanders, but it doesn't mean the outbreak's over. It just means that I don't believe we need the lockdown to manage this outbreak going forward. We can use those other restrictions and the response that Queenslanders have put in. So this is really, really important. So over the next 14 days, if everyone in Queensland can do the required processes, the required response, which is wearing masks, always indoors, unless you're in your own home or you're at work and you can socially distance because you're in your own office or you're in an area where you can socially distance. Or of course, if you're in your own car and there's no one else other than your family in the car. So you do need to, but everyone knows brilliantly what to do. You need to use some common sense. So it's indoors unless you're in a situation by yourself or you're sitting down to eat or drink. Once you sit down to eat or drink, or you're under the age of 12, although I must admit I've seen a lot of kids out there wearing masks, which is great to see. They don't need to, but if they would like to and they can do it, then why not? It's a great thing to teach our kids going forward. So mask wearing is really important. Outdoors, it's great to see. I think everyone's got a mask on except us two. It's great to see everyone wearing masks outside. But if you're by yourself outside, you're at the beach, you don't need to. Of course, if you're strenuously exercising, you don't need to wear a mask. I don't want people to compromise their health by wearing a mask. That would be illogical. So strenuous exercising outdoors or indoors in a gym, for instance, you don't need to wear a mask. So please do use some common sense, which is what I've been seeing happening. So that's first, that's masks. Then secondly, please only have a maximum of 30 people in your own private residence, because we know that's where transmission first happens. So if we do have a case, we know that that's where we'll see it transmit. We saw it with that party down at Byron Bay. Those 11 people, they were in an Airbnb, so a private residence, and now all of them, virtually all of them, have become infected. So we know that private residents are a risk. So maximum of 30 people in a private residence, and make sure you know who they are, so that if you do have a case, we can come to you and contact trace all of those people very, very rapidly, because we know this virus transmits rapidly in many cases. So that's really important. Then the other one is that we need to keep our most vulnerable safe. When the vaccine has not yet been rolled out for long enough to our aged care facilities, and we know to not enough of them. So that means aged care facilities, disability care facilities, our hospitals and our prisons need to, for the next fortnight, only have end-of-life visitors. They can't have other visitors, which I know is very, very difficult over this Easter period. So that's another concern, but we need to continue that going. Hopefully when we get all of those sites vaccinated in the future, we won't have to do that again. But we need to at the moment, protect our most vulnerable. Then the other thing, I know this is difficult for businesses, and I thank businesses very, very much for their support. Everyone needs to sit down in any hospitality venues, any venues indoors. They've got to sit down while they're eating and drinking. Take their mask off, of course, when they've sat down to eat and drink, but sit down. You can get up to go to the bar if you're in a pub to pick up your drink or your meal, but then go back to your seat. And that's important because we saw transmission of this virus in the restaurant in Byron Bay. So someone sitting at an adjacent table. So we need to know who's sitting where so we can work out who's highest risk and make sure we get hold of them very, very quickly. Then the other thing I ask of everyone is please make sure you do leave your contact details so we can really quickly get hold of people. Just double check, it's so easy to do. I've done it myself. Make sure that the mobile phone number you leave is accurate. It's so easy to get one digit wrong. Just double check when you put that information there, because the quicker we can get hold of people and contact trace, the quicker we can then immediately get out of whatever issue it is. So there's a lot of things there. They're really important to do, and if everyone does them, we'll get through this as quickly as we can. Then I'm leaving the most important to last, but you all know this one. That is, if you're sick, just stay home. Doesn't matter how mild your symptoms are, just stay home and enjoy your own home. And get yourself tested. That's critical. That is the most critical thing that will keep all Queenslanders safe. Thank you very much.
Well, good morning. Today's result is just about as good as you could have hoped for on day 3 of the lockdown, to have just one case, but a case that was already identified as a close contact and in quarantine. That's a very, very good result. And to every Queenslander who got tested, every Queenslander who has been isolating, to every Queenslander who put a mask on, thank you very much. To our essential workers who kept us safe through this period, including our supermarket retail staff, thank you also. As the Chief Health Officer and the Premier have outlined, we do need to maintain some restrictions for the coming 14 days, and I know they will be particularly distressing to those in aged care facilities or with family members in aged care facilities that they had hoped to visit over Easter. Unfortunately, they're necessary because only a third of aged care residents have been vaccinated, and almost no aged care workers have been vaccinated so far. Similarly, very, very few residents of supported disability accommodation have been vaccinated, and for those reasons we need to maintain those lockdowns for 14 more days until those vaccination levels are increased, until we see a higher density of vaccination in aged care. Then those lockdowns will need to continue to be applied if and when we have our outbreaks. The fact that we have 9 new cases today in hotel quarantine amongst returning travellers underlines the ongoing risk of returning travellers bringing back new strains from right around the world, where they are still suffering from the worst of this pandemic. And I just underline again that we would not be facing risks like this if the Morrison government had engaged with us on the construction of a national quarantine facility. Yesterday, David Littleproud said that whatever the states needed, the Commonwealth would provide. Well, we need a national quarantine centre so that we can reduce the risk of returning travellers, so that we don't have to cut back on the number of returning travellers when we have an outbreak. What you saw yesterday, I think, was a very cynical attempt from David Littleproud to use the number of vaccines delivered to states and territories to try to get Andrew Laming out of the news cycle. And I think while that might have worked, we can all agree that David Littleproud is 2021's April Fool. But he should not have risked confidence in the vaccine for the Morrison government's political benefits. We have right now on hand just 3 days' supply of the Pfizer vaccine. We have 12 days' supply of the AstraZeneca vaccine, and at current rates that could just be 8 to 9 days. And if you think about the fact that that is the vaccine that we are distributing to our regions and to our remote communities, we need ample supply of that to ensure our hospitals have it. We've heard a lot in the last 24 hours from GPs about their experience of vaccine supply, about how they don't know what vaccines they will be receiving, about how they've been booking people in for vaccines and then had to cancel them when their supply was received. And I think it just underlines those calls for better transparency about the number of vaccines out in the community and the number of people being vaccinated. I want to finish on some really good news, and I want to thank Woolworths for coming to our assistance yesterday. At about 3:20 yesterday, the Palm Island Council contacted us to say that they had no masks on Palm Island. By 5 p.m, Woolworths had contributed 12,000 masks. On their way to Palm Island. They should be arriving there this morning. Woolworths have also committed 60,000 masks to the Torres Strait Islands, and they're on their way there now. So I thank them very much for their support and assistance.
Morning. So in the last 24 hours, we've seen quite a bit of activity. We've done 1,001 intercepts We've responded to 76 calls for service in relation to COVID matters. We've done 92, I should say, business inspections, and we've handed out 572 masks in our community across the state. Regrettably, this morning a young male was issued with a penalty infringement notice for failing to comply with a health direction that is not being out for a permitted purpose, in fact was out for an unlawful purpose, so that person's been fined. And yesterday at Brookside Shopping Centre, a person, after being directed by police to wear a mask, has refused to do that, so that person has been issued with a notice to appear before the court. Can I just say that's been a mighty effort right across Queensland, and thank the community for their cooperation with this and allowing us to get to this point where we can see these restrictions relaxed. But can I also ask the community to replicate that mighty effort on our roads this weekend? With the lifting of the restrictions, we know that people will want to take advantage of that and start to travel. We expect high volumes of traffic across the state. Traditionally, Easter is a very high risk period for us. We do not want to lose one person on our roads this weekend over Easter. We do not want to see that. So please, please abide by the road regulations. Be patient when you're out there. There's likely to be congestion. Don't rush to get where you need to go, and work with us, and you can expect police to be out there enforcing the law. Thank you.
The earlier time of midday, that's just going to allow people to get away, so you've got that big rush.
Well, the advice from Dr. Young is that we can lift it from 12 o'clock. She's satisfied with that testing results and the fact that we have that linked community case. But of course, you know, the police also provided advice as well, and that 12 o'clock does allow people to safely commute on our roads rather than leaving it till later this evening. So I ask everyone to please look out for one another on the roads, take your time. I think there is going to be congestion, there always is on a Thursday leading into Easter, so please be safe.
What are the caps on weddings and funerals?
Sorry?
What are the caps on weddings and funerals?
20? Back to normal. Oh, back to normal. Oh, back to normal. Yeah, back to normal.
Of 200 QAM staff in the world, only 7 have been vaccinated. Why these frontline workers? Why?
I'll have to find out about that, Lane, but as I said, like, our priority was that 1A category, which is the frontline health workers. They're rolling that out as quickly as they possibly can, and like you heard from the Deputy Premier, we have limited supply on hand.
Do we know how many frontline workers?
I can get Dr. Young to answer that. Yep.
There's a difference between frontline workers who are dealing with positive COVID cases and frontline workers looking after other cases. So the requirement that came in this morning is that anyone who is looking after a COVID case, whether in our quarantine hotels or our hospitals or our ambulances, must be vaccinated. Other frontline workers are in 1B, and they'll get vaccinated as that rolls out over the next month. Yes, so my advice is that by midday today, we believe that all of the 1A frontline workers who are looking after hotel quarantine or hospital cases will be vaccinated. Now, remembering that people come in and out of that category. It's not a fixed category, so we know that there were 37,000, but some of them will have gone back to other duties and other people coming in. But the requirement now is, before you can actually come in and be a frontline worker looking after a positive case, is you have to be vaccinated. Well, no, that's correct. I am satisfied because we've closed that ward. There are still some patients in there that we're managing to move out to other parts, but yes, we're managing that. We have enough capacity.
What will happen with the PA hospital? Will people, is it still going to be in lockdown for how much longer? How many patients are elective surgeries still being cancelled? How much longer for?
Right. They just have to work through and contact trace everyone who's potentially been in contact with those two particular patients, and also all of their staff, that have been in contact with each other. It's a massive job. So it's really when they can get through that job.
Why not be a bit more targeted in the statewide measures in terms of areas that have either had cases or suspected cases? Why do it statewide in areas like Longreach, which have never seen a case?
It's a very, very sensible question. The reason is that people in Brisbane, after the lockdown, can go anywhere in the state. So then that risk goes with them. I think the risk is low, that's why I've advised that we can do this, but it is there, which is why I think that 2 weeks of restrictions across the whole state will keep our whole state safe. And I genuinely believe that wearing masks, sitting down when you're eating and drinking, protecting our most vulnerable and limiting people to 30 in their home is actually not a big requirement for the safety it gives us. It gives us enormous degrees of safety for, I understand inconvenience, and the one I'm most concerned about is the fact that I'm not allowing people to go into aged care to visit their loved ones. But I really think wearing a mask, Queenslanders have done it really well. Minimising to 30 people in your home. Sitting down, I know that sitting down is different to what people normally do. You normally like to stand up when you go into a pub, but the density hasn't changed, so the same number can go into the pub or the nightclub, but it just means it's so much safer. It's unbelievably safer. So that's why I think those restrictions need to be in the entire state. Otherwise, we would have to not allow people from Greater Brisbane to leave for 14 days. And I don't think that is reasonable.
Dr. Young, we have that.
The new case today, yes, from that Wide Bay area. Yes, so they're a close contact of one of the other cases that's now in hospital in that area.
So is the latest case in Bundaberg?
Yes, but she's got sick, so I'm not sure of the transmission, whether she got it at the hens party, which she did attend, one of those guests, or whether she's got it from the person she shares a house with. 8.
Dr. Young, we had that case at Byron yesterday. How concerned are you about northern New South Wales?
Well, I'm concerned, of course I'm concerned, except that my colleague down there, Dr. Kerry Chant, has put in very similar restrictions to what we are putting in here for all of Queensland. She has them in place for that whole northern New South Wales area. So that again, for the same reason I've done them here in Queensland, because of course we all talk and we've been talking every single day about what we're all going to do. I think having those similar restrictions will protect those people in northern New South Wales.
The exposure sites of
Genomic testing hasn't been enough to convince you that cases were linked in terms of opening borders from other states. Quite a few of the cases in this cluster of people only genomic testing. Is that now enough to satisfy cases?
It is for me, because I can see where those transmissions have happened. I still don't have that direct link going back to the doctor who got infected at PA to those gentlemen in North Brisbane, but I can see how it's happened, and it happened quite a while ago. So I'm reasonably comfortable, because of all the testing that's been done, that we don't have other chains of transmission out there. So it's just, I'm getting so much information because of the magnificent job that's been done by Queenslanders. Without that testing, I'd still be very cautious, but I've just had so much testing, which has been fantastic.
people who have visited those exposure sites, do they still have to self-isolate?
Yes, there are different degrees of infectivity in those different sites. So all of those people have been contacted, and the ones that need to be in quarantine have been told, and they must stay in quarantine till the end of their 14 days, because they are still at risk of definitely of getting an infection. But like this case today that I told everyone about, that case was in quarantine during their infectious period. So all of these other people we've placed in quarantine must stay there for 14 days. So if they become positive, they'll have been in quarantine during their infectious period.
Can you say whether the latest case... Can you say whether the latest case is in Bundaberg Hospital, and are you concerned about the fact that the Premier said there was 81 cases in hospitals across Queensland? Are you concerned about the capacity anywhere?
I'm not concerned about the capacity because we are a health service with over 10,000 beds. What I'm concerned about is the amount of virus each person has, and we are seeing very low cycle times for a lot of these people. That means they've got an enormous amount of virus. We didn't see that early in the pandemic. They were different variants, and we didn't see that amount of virus. So we know the risk is extraordinarily high, and we are getting more and more of these extraordinarily high risk patients in our hospitals. And it is so easy for one tiny error to lead to contamination of a healthcare worker. So it does worry me that we've got over 80 cases in our hospital system that we're having to manage, and they are such high risk cases. That's why it is so critical that we've been given that go ahead for the next 2 weeks to halve the numbers of travellers coming into Queensland. But again today we saw 9 positive cases. So that of course only came into being midnight on Tuesday night. So yesterday we had the halving first come into place. So we won't see that spell out for a few more days in terms of cases. But it's critical for us. It is a concern that we've got so many infectious people in our hospital system.
Dr. Young, what's happening?
At the moment, I have 2,742 contacts. Not all of them are in quarantine. Some of them have been asked to test and isolate till they get a negative result. So not all of those are in quarantine. We have 118 exposure sites, which you can go onto our website to see. Some of those exposure sites mean you've got to go into quarantine, others mean you've got to be tested and isolate till you get a negative result.
Are all of those exposure sites on the list? We've been told about one today at Mountain Creek.
Yeah, we're continually adding because this is really tough on people, and these cases have been brilliant. We've now got 8 related to the first cluster, 12 related to the second cluster, and people remember things, and they are so good because when they remember things they come and tell us straight away, and then we put that information on our website. So thank you for reminding me. Could everyone please continually go and just check that website and just check if you've been to any of those venues. Of course, those people who've been putting their information in through one of the apps or giving their details, we contact them as well. But also for people who haven't put their details in, if they could just come forward and get tested, that's critical. The bridal party can.
Doctor, can I just take you back to the...
Unless you're outside, you can dance outside.
Can I just take you back to the...
They've all got to wear masks at the wedding.
Not the bridal party, but yes, and they can take masks off for photos.
Can I just take you back to the aged care facilities?
Yes.
Can you quantify in any way what extra protection it will give making it statewide? Because you're sort of blocking people in regional communities from visiting their families over Easter for what must be a minuscule amount of benefit in the scheme of things. I mean, can you quantify that decision in any way?
I can, and it's what happened in Victoria. We know you can just have one case go into an aged care facility, one case. And if they're asymptomatic and you don't know that they're unwell, and so you've screened, which our aged care facilities are doing beautifully, and you let that one case in, they can infect nearly all those residents, and we can see very high death rates. So I understand how awful this is that people can't go and visit, and of course wherever possible I encourage them to use Skype and phones and really keep in contact, but I am asking people to wait for 14 days.
Why not
so
target
here in Brisbane we've had 56 out of our 186 aged care facilities that the Commonwealth has been going in to vaccinated. That's not enough, and it's only just rolled out, so the protection is not enough.
Would a middle ground though not be just to target it a bit better to major metropolitan area? It just seems baffling that in the far north of the state.
I agree with you, except that I've been burnt. So in the past, do you remember going back to the Brisbane Youth Detention Centre? I went and put requirements then and thought I'm being mad, I'm being ridiculous. And then we had a worker who was positive, I don't know how, who ended up, it was a, contact with someone who worked at that healthcare centre, and I just thought, oh, that was the right decision to just not allow visitors and to require them, because we do more than stop visitors. We also increase the PPE use. We do a whole range of other things as well once we declare a restricted area that impacts aged care. So that prevented that aged care residency getting an outbreak. Then we've had other ones in North Brisbane where we almost had an outbreak. The last thing I want to see is just at the last hurdle, which is where we are. We're rolling out the vaccine to every aged care facility, an outbreak, and have a whole lot of deaths.
Can I just ask Stephen something? Prime Minister's office is saying that Queensland received 12 weeks of supply on March 16th.
That's not the data we have to hand. That's not the data we have to hand. Half of the stock of AstraZeneca was received in just the last week, and as I outlined, if we continue at our current rate, which is a record daily rate, we have less than 12 days supply of the AZ vaccine, around 3 days supply of the Pfizer vaccine.
It's not right that we receive 12 weeks.
Yep.
Premier, due to the impact on business, your policy and another impact, will the government be considering further assistance for those applicants?
Look, I'll ask the Treasurer to have a look at that. It has been very tough on businesses, but let's hope, fingers crossed, over the Easter period and into the school holidays, that people will get out there and support our businesses who have been doing it tough over the 3 days. Okay? Thanks everyone. Thank you.